According to figures from Johns Hopkins University, the United States recorded on Wednesday over 3,700 fatalities and 250,000 cases of COVID-19 in 24 hours, a double record since the beginning of the pandemic. With new cases of the infection in California averaging more than 32,000 a day, nearly as many as the entire U.S. was seen just 3 months ago, hospitals in parts of the state are running out of space in intensive care wards. The number of available intensive care unit beds in California's San Joaquin Valley is hovering near zero. In Fresno County, officials said just a few ICU beds remain available and were filling rapidly. To keep up, the county's hospital system has contracted with a Virginia company to supply doctors, nurses, and others to staff a temporary 50-bed facility that will start receiving patients by the end of the week.
Been very concerned about the trend that we're going through, and right now we're in really high capacity in all the hospitals in the Central Valley. I'm talking specifically about Fresno. So we have a very high number of patients in-house at this point. There's so much stress on us, nurses and physicians, and all the healthcare workers are really working so hard through this, hours and hours and hours and hours per day, non-stop. People are taking 2 shifts just to, get through this.
In the Central Valley, we have a lot of migrant communities, farming communities. These communities tend to have higher morbidity. They already have higher burden of disease, underlying health conditions. Also, their access to healthcare is not as easy as perhaps other communities.